Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Saxagliptin. Its brand name is Onglyza. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, in this presentation, we'll discuss the mechanism of action, or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Saxagliptin. We're going to discuss examples of dosing, and then finish it off with side effects with percentages. I've put together some slides to go over this information. Let's just jump right into it. So the first thing to discuss here will be the mechanism of action, or how this medication works. So Saxagliptin is a dipeptidyl peptidase, or DPP4, enzyme inhibitor which exerts its activity in patients with type 2 diabetes by protecting the endogenous incretin hormones, which would be GIP and GLP-1, and by enhancing their actions. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in the treatment of type 2 diabetes mellitus. With respect to contraindications or reasons we would not be able to prescribe Saxagliptin, well, we wouldn't give this medication to a patient who had a severe hypersensitivity to Saxagliptin or to any other component of the formulation. This may present as anaphylaxis, angioedema, or exfoliative skin conditions. Now, for dosing with Saxagliptin, so in the treatment of type 2 diabetes mellitus, we would often see 2.5 to 5 milligrams orally, once daily, with or without food. Before the dose is taken, however, renal function should be assessed. As with all medications, there are some side effects or adverse reactions that patients may experience while using Saxagliptin, so I'll go over some of those here now. 1 to 8% of patients may experience peripheral edema, while 5.5% of patients may experience hypoglycemia or low blood sugar. A headache may happen 6.5% of the time. A urinary tract infection, or a UTI, may happen 7% of the time. 8% of patients using this medication may experience an upper respiratory infection. Now, one serious side effect with Saxagliptin would be heart failure. Alright everybody, that's all we're going to talk about today with Saxagliptin, or Onglyza. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.